Hey guys, what's up? This is Stephanie and welcome back to my channel. So in the video today, I'm going to be discussing what was my favorite rotation out of all the rotations that I did. So real quick, a little bit about me. I am currently a physician assistant certified. I took my PANCE and I passed it. I'm currently completing a critical care medicine residency also. So I hope to pursue that and get a job in that after I complete my residency. So what was my favorite rotation? So for my program, I completed a total of 9 rotations. So I did 9 rotations, which were OB-GYN, family medicine, emergency medicine, psychiatry rotation, surgery rotation, pediatrics, and then my other one was internal medicine rotation. I did an elective, which was in ENT, ears, nose, and throat. And then I did my last rotation in burn. So those were my 9 rotations. So out of all those 9, which one was my favorite one? I do have to say that I think my favorite one was definitely my burn rotation. So the rotation that I did in burn. And the reason why it's my favorite one is that I feel that I learned the most from this rotation. I definitely learned the most from this rotation. I think I grew as a student from day one until the last day. And I also grew as a medical provider. And then this rotation was the longest one out of all of my rotations because this was a capstone rotation. So I started in September, I finished in December. So it was about a 3 to 4 month rotation. And real quick about my program is my program's 2.5 years. It's one of those programs that's a little bit longer. So I have 1 year of didactic year, 2nd year of clinical year, where you do all the rotations that are required by the NCCPA to become certified as a physician assistant and licensed as a physician assistant. And then you have that extra rotation, which is also known as your capstone rotation for my program, where you complete a rotation and you're choosing. So it's kind of an elective rotation, but it's longer. And so that's where I decided to do my rotation in burn medicine. And the reason why I decided to do it is because I really enjoyed my internal medicine rotation. We did a lot of critical care. It was during COVID-19. We had a lot of patients that were very, very sick. And I rotated with a nephrologist. So I rotated a lot during the hospitals with him. And we took a lot of patients with acute kidney injury, hepatorenal syndrome, etc. And I really liked that rotation, that I wanted to do another rotation in critical care. So that's why I ended up doing the rotation in the burn center. And I'm very happy and blessed that I did because, like I said, I learned a lot. It was definitely the more difficult rotation out of all the rotations that I had. Not because of the preceptor, but just because of the patients that you were seeing and that knowledge gap that existed. Because, for example, in PA school, you only learn about burns one day. If not, it's just one lecture, right, on burns, and that's it. Well, during that rotation, you had an entire rotation, an entire specialty on burns. And not only were we treating burns, we were treating your other severe skin disorders like Stevens-Johnson syndrome, toxic epidermal necrolysis, pemphigus vulgaris. And not only that, you were also treating the comorbidities that the patients were coming in for. We saw a lot of neck fash, so your necrotizing fasciitis, which is your flesh-eating bacteria. And the majority of these patients have diabetes. So we were controlling their diabetes. We were treating their hypertension. We were treating their liver disease, their kidney disease, etc. So in addition to treating burns, and like I said, you were also needing to know how to treat the comorbidities. So you got everything. And that's what I really liked about that rotation and what really made me grow as a provider. And that's why I have to say that this one was definitely one of my favorite rotations. So for those of you who are interested in critical care medicine, I really recommend you doing a rotation, an extra rotation, whether it's an elective rotation, right, or your internal medicine rotation, and something that's critical care. It doesn't have to be burn, but just anything in critical care. And there's so many specialties that you can do for critical care medicine, post-transplant, right, surgical trauma, etc. But that rotation was amazing because you also got surgical trauma there, right? Especially those patients that just came in, they have severe burns, you have to take them to the OR and operate on them. So you got a little bit of everything, and that's why that was one of my favorite rotations. In addition, that rotation, we did a lot of rounds. And so rounds is where you, in addition to a lot of healthcare providers, like discuss the patient's medical status, right? What is the best treatment for the patient? What are we doing to treat this patient? So you have the doctors physical therapy, occupational therapy, psychiatry, since a lot of these patients have psychiatric problems like PTSD, right? Acute stress disorder, anxiety, because they were just involved in a burn. Or we have a lot of military folks that we saw. So in addition to them, you also had nutrition, right? You had the nurse, the charge nurse. You also had social work. So we all worked together to ensure that we were providing the best treatment for this patient. So that was another thing that I liked. Also consults, we were able to make consults, whether it was with nephrology, whether it was with infectious diseases, because the patient we had cultured not a common bacteria that causes cellulitis, right? And that was another thing that I really liked about this rotation is the consults, because I try to pick the brains of the specialists that would come in. And in addition to that, I learned a lot about wound care. So I tried to learn a lot as I could from the nurses, from the LVNs that did the wound care, and they taught me a lot. So I tried to learn a lot from them. I learned a lot from nutrition, the importance of nutrition in critical care medicine. And another thing that I really liked about this rotation is that they also offered lectures every day. And so once I finished seeing my patients, if I had time and I had finished charting on all my patients, then I would go and attend a lecture. And the lectures were usually given by the doctors, the attending doctors, and we had a variety of lectures. We had lectures on burn, we had lectures on ventilators, we had lectures on delirium, right, which was given by a psychiatrist, like how do we treat delirium. So I really, really liked this rotation for those reasons. It was definitely one of my favorite rotations, and I think this rotation really helped me out in getting accepted into the critical care medicine residency. This residency was just very competitive. I interviewed, there was 30 people including me that were interviewing. A lot of people applied, and this residency accepted both PAs and nurse practitioners, and they only accepted 2 students, and I was one of them. So I was very grateful. And I do have to say that thanks to this rotation, it allowed me to get accepted into the critical care medicine residency. And then on top of that, it made me a better student, a better medical provider, how to think critically more. And I learned a lot of pearls that I'm definitely going to use as a future medical provider. So yeah, that was definitely my favorite rotation out of all the rotations. I would say the second one was possibly my nephrology rotation, like I discussed. But I enjoyed all my rotations, but by far those were my top 2, and my top 1 was the burn. All right, guys, as always, I hope this video was helpful for you guys. If you have any questions or comments, make sure you comment below, and I will talk to you guys later. Bye.